I see there's 3 people on. I'm just going to wait till a few more people are on before I start talking. All right, so I'm going to start by answering some of the questions that were in the previous comments on the Facebook page. But as I answer those, all of you can comment in the comment section where you're saying hi with any questions. And we have about 40 minutes to just kind of chat about whatever you guys want. So I'm going to start off by looking at these comments here. So I'm just going to start at the top. So I have some questions. I think I've answered some of them in the PowerPoint slide. So one of the questions, is the risk increased for those with known kidney impairment, whether it is autoimmune related or not? And I'm thinking risk of COVID-19. And not that I'm aware of, the risk of kidney impairment really is dependent on how severe the kidney impairment is. And as you saw through in those high risk categories, if you have kidney impairment to the point where you're on dialysis, you'd be more at risk of severe COVID-19 if you acquired it. Is there any data available on PBC outcomes from other countries that started COVID-19 before Canada did? Unfortunately, since PBC is such a rare disease, there's no data yet. There might be some in the future, but I haven't seen any data as of yet. The last question is it advisable for PBC patients to obtain a vaccine for COVID-19 if and when it becomes available? That is a tough question to answer. It depends on the vaccine itself. So if the vaccine is a live vaccine, meaning that it has actual virus particles in it, in immunosuppressed patients, meaning their immune system isn't fully working or it's diminished, we usually tend to stay away from live virus vaccines. And even in cirrhosis patients, I tend to stay away from live virus vaccines. If this is a attenuated vaccine, meaning the virus is dead or partially live, then that's a different story. Is it advisable for PBC patients to return to pre-COVID-19 lifestyle prior to a vaccine becoming available? That's also a tough thing to answer. It depends if what the vaccine is. There's a chance that we might not be able to even come up with a vaccine. And it really depends. So that's more of a public health question than a purely PBC question. The next question is, what is your experience with PBC patients in stage 4 whom URSO isn't working as well anymore, starting Ocala? Would you recommend trying it? So this is a discussion with a provider who prescribes Ocala. In someone who has PBC and URSO isn't working, you are at risk of progressive liver disease, cirrhosis, and end-stage liver disease, and possible transplant. In that answer, so if you're not responding, Ocala has been shown to improve the biochemistries of someone who's not responding to URSO and such. it is prescribed in that situation. And I have prescribed it, and it does have a few side effects. Itching is one of the major side effects, but it is treatable with medications. So that is dependent on your disease and really how severe it is to begin with. But if you have a provider who's experienced in prescribing Ocala, it would be a discussion with them. Next question is, I have compensated cirrhosis, and my 6-month ultrasound screening for cancer was canceled with no rescheduled date due to COVID-19. I'm concerned, and I'm wondering how long I can actually go without having the screening. That's a great question. Unfortunately, with COVID-19, the risk seems to outweigh the benefit of having these liver cancer surveillance ultrasounds. Fortunately, liver cancer is quite a slow growing cancer. And with PBC, there seems to be less of a risk of actually getting liver cancer with the underlying liver disease compared to other liver diseases. So I think for the meanwhile, it's safe to wait for this liver screening ultrasound, but hopefully it comes back soon so we don't have to miss too many of these every 6-month ultrasounds. Next question, is there any advice for keeping healthy and sane while staying at home? How and when would you seek care outside of COVID? Also, any tips for diet and exercise? Advice for keeping healthy and sane. So it depends on the person, but I would say to have a structured routine, try to stay active as much as you can. Try not to drink too much alcohol or other substances, and try to eat healthy and get sleep. It's the usual things, but it's mainly dependent on the patient. It's very important to reach out if you're feeling ill, if you're feeling like your mood is down, or if you feel like you're becoming anxious. And the way we do it in Nova Scotia is many family physicians do have telehealth availability, and we do use virtual care here. Most specialists are available as well. I'm still seeing my patients either through just over the telephone or with virtual telehealth over Zoom, and it seems to be working quite well. Diet, I always am a proponent. I always emphasize diet is one of the most important aspects of keeping a healthy weight, and it is very important for the liver. My suggestion is always to stay away from any food that says high fructose corn syrup in the ingredient list. It is liver toxic and increases the risk of fatty liver disease. Coffee seems to be good for the liver based on all the studies that are out there. So I usually recommend in patients who like drinking coffee to drink 2 to 3 cups a day. That's black coffee without added sugar, without added cream. Remember, with alcohol, if you have advanced scarring in your liver, it is best to practice abstinence, meaning no alcohol. And it's very important to even look in your mouthwash to make sure there's no alcohol in the mouthwash. If you have no significant scarring, I usually recommend no more than 3 to 5 drinks a week, no more than 1 or 2 in a sitting. Moving on to the next question. What precautions does someone with stage 4 decompensated cirrhosis need to take during this pandemic, other than work from home when possible and physical distancing? Those are very important. I did touch on this in my presentation, but it's very important if you have decompensated cirrhosis to reach out if any of these decompensations, meaning ascites, which is the fluid accumulation in the abdomen. If you have confusion due to your liver disease, there are medications that can be used to treat this. Or if you bleed, meaning you vomit blood or you start bleeding when you use the bathroom, it's very important to go to the emergency room or call 911. One of the last questions here is, I had issues with my kidney function being at 30%, possibly from naproxen, which is a non-steroidal anti-inflammatory, or NSAID. After 2 weeks, it was checked again, and it had risen to 50%. There has been no follow-up since, and recently I've read that others with PBC have had similar issues with kidney function. Could low function be caused by PBC or other related autoimmune issues? PBC itself doesn't tend to cause kidney dysfunction. Sometimes when PBC causes severe scarring in the liver or cirrhosis of the liver, this can increase the risk of getting kidney dysfunction, especially in the setting of non-steroidal anti-inflammatories such as naproxen. Naproxen, even in healthy people, can cause kidney dysfunction as well, and especially as we get a bit older. There are autoimmune diseases that can cause kidney dysfunction, such as most of the ones I've mentioned already, Sjogren's and lupus, but there's a number of other ones, but usually they don't improve and slowly get worse. Given that your kidney function improved after stopping the naproxen, it was the likely culprit. So that's all the questions I see on the Facebook page. Let me go down in here and see if there's any questions. So there is one comment saying that I'm nervous about getting my blood work done at the hospital or clinics. And this is a good comment. It's very important. If you feel unsafe to get blood work done, there's no issue in asking your physician before getting it done. Lots of the blood work we do is for surveillance, almost like the liver ultrasounds. And it is safe in some patients to withhold blood work, just like it's safe to withhold ultrasounds for a certain amount of time. And so that can be relayed to your physicians. I'm just looking to see if there's any other questions. One question is, as a post-transplant person, should I stay in my home unless I just go for a walk? I think that's good advice. The safest place anyone can be right now is in their home. Going for a walk is safe, and I would just always suggest staying away from people up by 2 meters. Someone watching from England, that's nice. One question is, am I more vulnerable if I catch COVID-19? And I did mention that in my presentation, so it's difficult to say without knowing your story, but in general, patients with cirrhosis of the liver, patients who are post-transplant, and patients who are on immune-suppressing drugs are more vulnerable to having more severe COVID-19 illness. There's a question here, nothing has worked for my itch. What would you suggest? They took me off Ocala and still no relief. So there are a number of options for itch. Some of the initial things that are usually tried are things such as lotion or hydroxyzine. They usually don't work too much, but cholestyramine works very well in some patients. It is difficult to digest, but cholestyramine would be my first choice in most patients. It's very important to take that 2 hours away from all your medications. One medication that I've had a good amount of luck with is an antidepressant, which is actually called Sertraline. It does take a little while to work. It takes about 4 to 6 weeks to work, but it has relatively few side effects. It is metabolized by the liver, so it's good to get low doses of this, but works quite well. And there's a number of other medications that are used, such as rifampin, that would be important to talk to your doctor about all of these medications. Ocaliva, it is important to try many of the medications before stopping the Ocaliva. Usually it's started for the reason that you haven't fully responded to URSO. And so if the itch hasn't gone away since going off the Ocaliva, I would suggest treating the itch with some medication and then trying it again. So one person asked, wondering about my abdomen protruding. I was diagnosed with PBC in January, but it's sticking out for the last 2 years. Will diet changes fix this? So it's very important to know when your abdomen is protruding, is this fluid? And I've mentioned ascites a number of times. Or is this gas? Or is this from eating, which would be, if you're eating too much, it can be fat. So with fluid, it's very important that you discuss that with your physician, because it's very difficult to diagnose through a comment. But if it is gas, usually there's associated belching or gas coming down from below, or just it comes and goes a lot. And sometimes a FODMAPs diet, FODMAPS, can help with that gas-producing foods, and it tells you which foods you can decrease. If it is fat, dietary changes can help that as well. With fluid buildup in the abdomen, a low-salt diet can help that. So you can trial any of those, but it's very important that you discuss a protruding abdomen with your physician. One person wrote, I'm having problems with my kidneys now, but cannot see my doctor or specialist. So it depends on how bad the kidneys are, and depends on where you're located. If the kidneys are getting very bad, it depends on, it's hard for me to say because I don't know where you live. If you're in Nova Scotia, there are other people you can call. So another question is, does the medication URSO make a person more susceptible to COVID? There's no data to say that URSO would make you more susceptible to COVID. And the mechanism of action of URSO, being a synthetic bile acid, wouldn't play a role in the way that you would acquire COVID. So it wouldn't theoretically either increase your risk. Have I tried a diet? My MD said not to worry about this diagnosis and continue with my life. I'm not confident about this. So in general, if someone's been diagnosed with PBC, there are a number of things to monitor. So the first thing is, does a patient have symptoms of PBC? And the main symptoms are fatigue, itching, and dry eyes, dry mouth, and abdominal discomfort can be a symptom as well. Having those symptoms can impair quality of life. It doesn't necessarily mean that you're going to have a shortened life. The other thing to look at in someone with diagnosed PBC is whether or not someone has advanced scarring in the liver. And it's very important that if someone has a diagnosis of PBC, that they are tried on ursodeoxycholic acid, or URSO, as a treatment for PBC. And then if someone doesn't fully respond or fails treatment with URSO, it's important to look at other medications to improve the biochemical response and thereby decrease the risk of progression of PBC. Do I know anything about plasmapheresis being beneficial to PBC patients with hyperlipidemia? The first comment I want to say about the hyperlipidemia is that hyperlipidemia in patients with PBC usually is not associated with increased cardiovascular risk. And on its own, there's not an indication to treat the hyperlipidemia, which means high cholesterol. If someone has risk factors or their cholesterol is so abnormal that you would start treatment, I've noticed that the normal cholesterol treatments do work for patients with PBC and their associated high cholesterols. If someone has high cholesterol to the point that they're getting complications from the cholesterol, that usually is a diagnosis that is not associated with PBC and maybe something that is a diagnosis in addition to the PBC. And plasmapheresis does work well in those patients when it's needed. This is a question. I'm scheduled for a biopsy Monday at a hospital, which as of recent has a small outbreak of COVID. Should I still go? I would discuss that with your physician who ordered the biopsy and leave that to them. I don't know the reason you're getting the biopsy. Usually when we schedule a biopsy, especially in this time, it's for an important reason. But I would not skip that unless your physician who ordered it specifically told you to. And it's very important to remember that even if there's COVID-19 in a hospital, it's probably the safest place to go still because we use very good precautions. Another question. For the last 6 weeks, I have been experiencing a lot of hair loss. Could this be PBC related? So tough question, but hair loss is it's a tough thing to diagnose and to treat. Hair loss can be associated with autoimmune illnesses associated with PBC. It can also be one of the side effects of URSO, unfortunately. It's not a very common side effect of URSO, but I usually, you have to weigh the risks versus the benefits. It's important to have someone look at the hair loss to ensure that it's not an associated condition that has a different treatment. But if it is related to URSO, I suggest not stopping it because of the benefit that URSO carries with this diagnosis. It is also important to look at other causes. So the thyroid, if you have a low thyroid, meaning it's producing less hormones, it can cause hair loss. Also, iron deficiency anemia can be assessed on blood work that can also cause hair loss and should be treated. I'm glad to see someone, they commented, Sertraline worked for me. It does work well, you just have to give it a chance. Another patient, and I'm sorry, I think you're the same one. Many of those didn't work, and you are on rifampin. So it's difficult to know exactly without seeing you. It is important to know that other illnesses can cause itching. And there is a time where some patients can be on all of the medications I've mentioned and still have issues with itching. There are other options like UV light. And if it gets severe enough, you can go on naltrexone, which is a type of medication that affects the itch receptors in the brain. And then there are some more intensive, even plasmapheresis, like mentioned before, can help with itching if needed. It's a bit more invasive though. Do multivitamins interfere with URSO? It depends what's in the multivitamin, but usually not. Another question. I am a year in with PBC. I have had no staging. My latest blood is normal levels, and I've had 3 MRIs in the past year. Shows no liver damage. Would this suggest early disease? Do I need staging if I'm doing well? Difficult to say. Staging can be done in a number of ways. Staging can be done with blood work. It can be done with MRIs, and it can be done with what we call fiber scans. Fiber scans aren't available in every community or every physician's office, but it sounds like you've had quite a few investigations. but I can't say if you need staging or not. You may have been staged without even knowing. Could taking an excess amount lead to I think you meant PBC. Maybe comment that question again. I'm not sure what excess amount of what you're saying. Oh, Advil. So could taking an excess amount of Advil lead to PBC? There's no evidence that taking Advil leads to PBC. Advil can cause complications if you've been diagnosed with PBC and have advanced scarring in the liver, but it hasn't been known to cause PBC. Another question, I've mentioned ascites. What is that? Ascites is the accumulation of fluid within the abdomen. When the liver becomes scarred up, blood flow that goes through the liver from the stomach and colon and everything, it has a difficult time getting through that scarred up liver. And so what happens is it seeps out from the liver, almost like an old sponge that stopped working, and fills into the abdomen. The ascites is an indicator of more advanced scarring, and that's why I mentioned that it is associated with cirrhosis of the liver. Is hair loss and weight gain a side effect of taking urso? So usually less than 3 to 5% of patients have any side effects to urso. The most common side effect would be kind of an upset stomach or nausea, and that usually goes away with time. Hair loss can be a side effect of urso, but it is rare, and it's very important, as I mentioned before, to look at other causes of hair loss before even thinking about getting rid of the urso. And I always mention that it's very important to weigh that risk versus the benefit of urso, because urso does change the natural history of PBC, meaning it improves life expectancy and decreases the risk of needing a liver transplant. Weight gain, I haven't heard of that side effect from urso. And so I wouldn't say that it's a big side effect. Another question, what blood work tests confirm PBC? My mother has PBC and you recommended my sister and I be monitored, but I don't know what to ask for from my GP. So PBC can be genetic in a way. And so sometimes in high-risk family members, I recommend an alkaline phosphatase, which is short to ALP, be checked. And if that's elevated for more than 6 months, that indicates cholestasis, meaning impaired bile flow. And so if that's elevated for a prolonged period of time, someone may need to be checked for the antibody for PBC, which is the anti-mitochondrial antibody, or some specific anti-nuclear antibodies. And in some patients, rarely, you need a liver biopsy. My last fiber scan was 4.9. I'm 25 years post-diagnosis. That's great. A fiber scan or a liver stiffness score based on your fiber scan being 4.9 is quite low. You have a better liver stiffness than I do. If I become unwell from COVID, what hospital would you recommend I go to in British Columbia? Unfortunately, I don't know which hospitals deal with COVID. There are certain COVID hubs. So in Nova Scotia, we have certain hospitals that are taking COVID patients before others. And that's more of a public health question than a question for me. If you have COVID, it's good to call the public health numbers. And I would recommend you go back to the Government of Canada website that I had in my presentation and just put in your information and they'll send you to the right place to go. It's important, though, if you are sick, to be seen either in an emergency room or call 911, especially if you have those high-risk symptoms. There was a comment that plasmapheresis didn't help with someone's itching, and that's unfortunate. What should you take for pain? What is better for the liver? So for pain, it's a loaded question because it depends on the severity of the underlying liver disease. In general, I recommend Tylenol or acetaminophen, which is it's another name for Tylenol. In patients with no advanced scarring, I recommend Tylenol as well. In patients with advanced scarring of the liver, I usually recommend no more than 4 extra strength Tylenol tablets in 24 hours. There's a number of other medications, but I don't want to get into them too much without knowing the actual, without knowing the patient's information. Another comment, I'm apparently at an early stage. Will alcohol accelerate my disease? It depends. I usually recommend that someone who has very early stage, meaning they have no scarring in their liver, or they have stage 1 or 2 scarring, decrease the Canadian moderation guidelines of alcohol by half. So in a man, that's usually no more than 6 to 7 alcoholic beverages per week, no more than 2 or 3 in a setting. In a woman, no more than 1 to 4 alcoholic beverages a week, no more than 1 in a sitting. There's a question, what does that feel like? Will that be an automatic filling of the stomach? I'm guessing you're meaning the ascites. Ascites feels, it's hard to say what it feels like as I've never experienced it, but if you were to have increased abdominal girth associated with leg swelling and you're gaining 5 to 10 pounds a week, there's really only one thing that can cause that, and that's fluid accumulation within the abdomen or within the body. Another question, I have varices. How can I minimize their growth? I'm 25 years post-diagnosis. I've taken Urso for 25 years. Can it stop working? So the nice thing about having PBC is that we do have a marker that tells us if the Urso stops working. It's very rare for it to stop working if it has worked for 25 years. And with varices, meaning dilated veins within the esophagus, we have a number of medications that can help make them go away. Those medications include non-selective beta blockers such as propranolol, nadolol, or carvedilol. And it's really up to the physician ordering them which one you get. There's also, if those don't work or there's a reason you can't take them, we do upper scopes where they take a scope and look down the food hole and look in your esophagus and see if the varices are there or not, and they can be fixed with the scope. My son has autoimmune hepatitis, primary biliary cholangitis, and ulcerative colitis. Gets a lot of headaches from the neck, perhaps, hence takes compared to me. And in my opinion, a lot of paracetamol, which is another name for acetaminophen. What is the best pain medication, as someone already asked? The best one for all patients with liver disease is still Tylenol or paracetamol or acetaminophen. They all mean the same thing. And if there is significant scarring in the liver, no more than 4 extra strength in 24 hours. I was in a study 4 years ago that took all of my 4 siblings' blood, and they all complied. My mom has been diagnosed with fatty liver with high alkaline phosphatase. So non-alcoholic fatty liver disease can also present with a high alkaline phosphatase. And so sometimes we do need other markers to tell us the diagnosis of PBC. I'm stage 4 and compensated and have been since the diagnosis 7 years ago. Is it possible to reverse cirrhosis? So with PBC, it's difficult to say if the cirrhosis can be reversed. All the medications that we have aren't a cure for the disease, but they mainly decrease the progression of the disease if a patient is fully responsive. So unlike hepatitis C, where we have a cure and we've seen reversal of cirrhosis and scarring, PBC doesn't have that option. And so I haven't yet seen any reversal of scarring or cirrhosis, but that's why it's very important to get diagnosed early and get on treatment early so you don't have progression of the disease. Is it good to know what stage we are and are FibroScans available in Nova Scotia? It is good to know the stage of scarring, but it is also important to know that the FibroScan hasn't been fully validated in PBC yet. And so we can't make all of our decisions based on FibroScan. We do have availability of FibroScans in Nova Scotia. It just depends on where you are. In Halifax, we have a number of FibroScans. I don't know of any other cities in Nova Scotia that has them. So this comment was, I was diagnosed at age 28 after the birth of my son. I'm 41 now, have PBC, Raynaud's, Sjogren's, gallstones, and a hernia. The latest liver ultrasound showed a change in part of it, and they say it's probably fatty liver disease. But how do I make this better? Wait, there's more to see. And this can be reversed. So fatty liver disease is kind of a presentation in its own. If I were to ultrasound all of Nova Scotia, we'll just say all of Canada, about 25 to 30% of everyone would have fat in their liver, PBC or not. And the most common causes of fat deposition in the liver would be having diabetes, having increased weight gain or obesity, and having what we call metabolic syndrome, which is a myriad of things such as high blood pressure, abnormal cholesterol, increased waist circumference, and abnormal blood sugars. If someone has fatty liver disease, it's almost the same as PBC. We have to stage the disease, meaning we have to determine how much scarring is in the liver. If there's a significant amount of scarring, it becomes more difficult to reverse. If there's less scarring, it becomes easier to reverse that fat within the liver. The way we do it is really with anything that can decrease overall fat loss or weight loss. And so if someone loses 7 to 10% of their current body weight when they are diagnosed with fatty liver disease, that usually improves both the inflammation from the fat within the liver as well as the scarring within the liver. Another question, what causes extreme fatigue? PBC can cause extreme fatigue, but there's a number of other causes of fatigue, and it's important to speak with your provider to know if you have any other causes. Some of the most common causes would be abnormal thyroid hormone production, such as hypothyroidism, iron deficiency anemia, and vitamin D deficiency. Those are the easy ones that can be diagnosed on blood work, but there are other causes as well. Sometimes we can't find a cause, and the extreme fatigue is from the PBC itself. And unfortunately, there's no good treatment for that fatigue. And even the liver transplant can't fix that, unfortunately. I'm going to answer a few more questions, but and then I'll have to go pretty soon, but I'll answer 3 more. What is the marker that means URSO has stopped working? So the common marker that is used is that marker of cholestasis or abnormal blood flow, the alkaline phosphatase. And that is how we determine if someone needs to be put on a different medication. So if someone's alkaline phosphatase doesn't decrease by a certain amount, we say that URSO has not worked completely. Does the alcohol modify the efficiency of the medication in moderation? So I'm guessing you're talking about ursodeoxycholic acid, but alcohol doesn't seem to impair the metabolism of urso or obeticholic acid that I'm aware of, but that's in moderation. Are increasing glucose numbers expected or common in later stage PBC? So as someone develops more scarring in their liver, I see 2 things that can happen. One, your blood sugars can get worse and you can develop diabetes, but sometimes your blood sugars get better and even too good in the fact that you get low blood sugars. And so it's not really, it's hard to guess what's going to happen. Usually patients with fatty liver disease get worse blood sugars. PBC, I haven't noticed a trend in either, and they can go either way. It depends on really the severity of your liver disease. I'll answer one more question. The Tylenol one came up again. It's very important to remember that Tylenol is safe in liver disease, despite what other people say. And in patients with compensated cirrhosis or decompensated cirrhosis, Tylenol is safe up to and no more than 4 extra strength a day, or no more than 2 grams of Tylenol in 24 hours. Have you heard of Herceptin making a difference in this? I haven't heard of Herceptin making any difference in PBC or COVID-19, if that's what the question was for. So I wanted to just thank everyone for tuning in. This was fun. It was my first time using Facebook Live, and you can these will be saved on the Facebook page, so you can watch them anytime. And to all my patients out there, I'll see you soon. Thanks. Bye.